Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your audio lines is in a listen-only mode. At any time during today's presentation, you may submit your questions electronically by using the chat pod located to the right of your slideshow. It is now my pleasure to introduce today's first presenter, Mr. Chris Hund.
Thanks, David. Hi, everybody. This is Chris Hund, Director for Clinical Quality with AHRQ of the American Hospital Association. And I'd like to invite you to December's monthly TeamSTEPPS webinar. This one is on reducing workplace violence with TeamSTEPPS. I'm talking to you from very balmy Chicago, Illinois, where when I just looked at the temperature, it says it's 19 out, which isn't bad, because I think it's going to be getting down to below zero, actual zero this weekend. So as I see the names here from places like Hawaii and San Diego, I'm very jealous of you, although I also see Syracuse, New York just coming in northern Maine, so I'm sure you have it just as bad as we do. Just some rules of engagement today and always. There's two ways to access the audio for this webinar. You could do it through your phone. You can call in the phone number that we had sent out, and if you do that, mute your computer speakers, because otherwise you'll get weird feedback. You could also listen just through your computer if you'd like. Of course, if you're listening through your computer, unmute your speakers. We're going to do a Q&A session at the end of the presentation, time permitting, and when we do that, we try to do it all via the written questions that we would like you to chat in to that box that you see on the right-hand side of your screen. Good thing about this is that you can ask questions as you go along. If they're of the logistical nature or some other sort of problem, we'll answer it. Somebody from the HRAT team will answer it. If they are something that's content-based, we'll gather all those questions together, and I will do a Q&A with the speakers at the end of the session. Okay, there's a lot of upcoming TeamSTEPPS events here. You see master training courses. There's registrations open for the first third of the year right now. We also have advanced courses. We accept applications for those. And this is a really great opportunity for people who already are proficient in TeamSTEPPS and are looking to make connections between the TeamSTEPPS work you're already doing in your institution and other sorts of quality improvement type initiatives. We're really looking here to make things sustainable, to go deeper, and to really embed in your organization. And the presentation you're going to hear today is definitely a good example of how TeamSTEPPS gets past solely the clinical world and really gets embedded. We also have a national conference. Registration's open for that. It's in Cleveland in June. We have a call for proposals. Proposals are actually due this week on Friday, so if you have a great idea, you could follow that URL over to learn how to propose something. All of these URLs are here because you have access to this webinar afterwards. You could download it. You see where it says Files in the upper middle right-hand corner of your screen to the side there. You could download it, and you get all of the URLs there. All these events, including this national webinar we're doing right now, are all made funded for free by the Agency for Healthcare Research and Quality. So many thanks to them, including our project officer, Dr. Barbara Bartman, and they are part of the Department of Health and Human Services. So everything here is for free because of them. And so we here at the American Hospital Association are very, very pleased and proud to be working with AHRQ on TeamSTEPPS. If you ever have any questions, there's that email that you could shoot us an email or call that phone number, and we'll be there to answer questions about how do you register for things, what TeamSTEPPS is it right for me, content questions about TeamSTEPPS. It's really kind of the catch-all place for you to get in touch with us, and we'll get back to you pretty shortly. Okay, today's presenters are people that I'm very happy to have here today because they are both from New York City Health and Hospitals, and they are, this this organization has been one of the original implementers of TeamSTEPPS. If I've got my history right, I think that Mei Kong, one of the presenters here, she was there at one of the first TeamSTEPPS trainings, so down in Carillion Clinic in Roanoke, Virginia. So you definitely have somebody here who's an original to the program, and because of that, NYCHC has done an incredible job of going out and bringing TeamSTEPPS past just the clinical world. And because of that, we have Joseph Sweeney also with us, who's the director for hospital police as well as the WVP coordinator. And that is, I think, so telling that they have brought in everybody in their system to really learn how to use TeamSTEPPS and to make it applicable to all aspects of healthcare. So very happy to have both Joseph and Mei here. They've presented at the national conference and do a great job. So looking forward to hearing today's presentations. Mei and Joe, turning over to you now.
So thank you so much for inviting us. Good afternoon, everyone. Welcome to the Mei and Joe show at WPVP, coming live from New York City Health and Hospitals. This show is dedicated to reducing violence in the workplace through TeamSTEPPS.
That's right, May, and for those of you joining us in Pacific time, you'll be thinking about workplace violence in the morning. Those of you on the East Coast with us will be thinking about workplace violence in the afternoon, and the rest of the country, which we're syndicating, communicating this message to across the country. For those of you in the middle, I guess it's around lunchtime, right? Brunch time, maybe? But our objective for today is to integrate TeamSTEPPS and to show you how to integrate TeamSTEPPS in a nonviolent intervention and improve communication. Reducing workplace and the violence is the key to every healthcare organization, and through use of early intervention, we hope to show you how we can reduce those incidents.
And you know, helping reducing violence enhances staff and patient experience and satisfaction, and building a culture of safety is our ultimate goal. But staff safety is also an important piece of it.
Well, that's right, May, and really the whole mission is to increase joy and meaning of work through knowledge, skill, and attitude.
So we all know that healthcare is super complex. It has many facets. However, for us to be successful in healthcare, everything needs to connect, just like a spider web.
Well, it's a tangled web we weave, May. But the real goal is to try and prevent these incidents from happening. You know, you want to prevent the fire before it happens.
So, you know, it's so true, Joe, that we have to make sure that the fire is contained, because once it goes up in flames, it's hard to really handle it. So we wanted to prevent it from becoming a crisis and make sure that we are all on the same page. So workplace violence is not just someone's imagination or perception. It is a true issue in healthcare.
Well, that's true, May, and you can see there's a lot of statistics that show that healthcare is has one of the highest incidents of workplace violence, and I think it's interesting, and that's the one thing I think TeamSTEPPS will help with. You know, for regular folks, we all have our gut instincts, and we feel pretty comfortable with them when we're out in the real world. You're in the supermarket, somebody's acting a little strange, you know to stay away from them. But for some reason, when you get into work, that sort of all goes away and is suspended for some reason.
But Joe, you know, healthcare is, like I said earlier, complex, because a lot of the staff members are task-oriented and they don't see what's happening around them. That's why teamwork is so important.
That's a great point. So you're saying that it's not that they lose the ability to be aware, it's just that they're focused on their task at hand.
That's correct. And if you look at OSHA's data, you know, 80% of workplace violence stems from patients.
Interesting. Well, I'd like to take this moment to thank our sponsors for setting this program up. We're sponsored by TeamSTEPPS and the people who brought you TeamSTEPPS, AHRQ, DOD, HRET, and AHA. TeamSTEPPS helping to reduce Violence in the workplace.
So TeamSTEPPS stands for those of you who don't know, is Team Strategies and Tools to Enhance Performance and Patient Safety. And the ultimate goal is safety for the patients and the staff. It's a terrific tool if you use it right. So communication and teamwork is the fabric of our lives. Unfortunately, the bad news is...
Well, that's right. The bad news is when communication doesn't go well, it's a source of tension and stress in the workplace, and it affects patient and staff safety.
Joe, you're absolutely right. However, there is a good news. Most problems can be solved or prevented with effective communication among members.
Yep, team collaboration is key, May.
And we need to weave it into everything we do. So TeamSTEPPS, if you look at the triangle, has the components of knowledge, skills, and attitudes that drives performance. But the four key tools in the box is leadership, communication, mutual support, and situation monitoring.
All excellent points. You know, I'm looking at communication and I know what a handoff is, I get what check back is, even a call out. S-bar, I know what an Irish bar is, but what's an S-bar?
S-bar stands for Situation, Background, Assessment, and Recommendation. And it's a perfect tool for all clinicians, all handoffs, or all sorts of communication so that it is standardized, but it also focuses us to think of those components.
And I'll bet leadership is one of the most important parts of this, right?
It certainly is. And as well as mutual support and situation monitoring.
I'm glad you brought up situation monitoring. We'll get to that later, but I think that's one of the most important parts.
Yes, and one of my favorite tools is cuss. I'm concerned, I'm uncomfortable. Whoa.
Hang on, we're on the air here, May.
We're talking about cuss with one S.
Oh, all right.
I'm concerned, I'm uncomfortable, and this is a safety issue.
Okay.
A very nice way to demonstrate urgency, but yet getting to the point.
I've heard your work blue before. I was just getting concerned. I don't want to pull myself on it. But, you know, when you talk about teamwork, one of the most important things is the structure of the team and everybody understanding what that is. And for those of you at home, if you have the diagram in front of you, you'll notice that at the bottom, the foundation of the team structure is the administration, the leadership. They're the ones who are going to set the tone for the entire organization.
Yeah, but you know what? It's also important to understand each person's role and responsibility, the role of the core team and the contingency team.
Absolutely, and what I like about this diagram is, to me, it's like an arrow. They're all pointing to the patient, which is really the most important part.
Yes, and the three structure that we like also is the prevent, respond, and report.
Absolutely. You know, we talked about you know, preventing the fire from starting, but also we need to, when we're unable to prevent, you know, workplace violence in a healthcare setting is somewhat inevitable at times. You got to be able to respond in the right way. And then if for some reason your response doesn't de-escalate the situation, you want to know how to report it and how to notify people so you can look at it and review these incidents and try and do better the next time.
Absolutely. And you know, violence can occur anywhere. And you know, we think of the absolute, you know, obvious ones, and that's...
Well, you know, you're right. It can happen anywhere. You want to focus. You want to look at the data, though, which tells us that we can take our resources and focus on specific areas where the incidents are higher, like a psychiatric unit. That's where most of the incidents occur in healthcare, is in psychiatric units, for obvious reasons. Emergency rooms, also a very tense situation with a lot of moving parts and a lot of additional problems. Most people who enter a hospital come through the emergency room. That includes psychiatric patients, so it can be a complicated environment to work in.
Yeah, and what about, you know, when they're on K2 or drugs, different type of alcohol withdrawal.
Absolutely.
But don't forget about the not so obvious areas such as waiting rooms. You know,
Waiting.
Waiting.
Yeah.
I mean, humans hate to wait unless they want something, such as going to a good restaurant or buying tickets to a concert. But humans don't like to wait.
Right. I'm waiting for Christmas. It's just making me a little edgy, to be honest with you.
It's only next week, one week
No,
away.
That's a great point, though, May, because waiting is one of those things where you may not see statistically in areas where people wait that they have a high incidence of workplace violence, but it doesn't mean we should ignore it. We need to focus on all areas, and that's one where we can make improvements that will reduce incidents of workplace violence and increase patient satisfaction.
And the other two areas that, people may not focus on is the geriatric units, where you have people that have Alzheimer's who sundown,
Yeah. And the traumatic brain injury unit is another one. And if you notice, a lot of these areas have something in common. The patients have what we call an altered mental state, and that increases the risk of workplace violence. So we talked about leadership being important before, and I feel this strongly. So there's a lot of different ways leadership can help the organization.
That's right. And, one of the key components is understanding each member's role and responsibilities. Because if you don't do that, you can't also impede the accountability part.
It's critical, and I think, we speak about patient satisfaction. These are all interconnected. The same tools that we use for TeamSTEPPS to reduce workplace violence are going to be the same tools that will help us get better HCAP scores and better patient satisfaction. Roles and responsibilities is a key part of that. But in leading, you must communicate. Share the plan with your team, and that's what we do in the briefs. A huddle so you can adjust the plan in the moment. And then when the incident or the situation is over, you want to debrief and see what went well and what didn't work.
The key to preventing a fire is to get control. And when the situation is organized, even though it's organized chaos, it's much better than total chaos, because that's what leads to crisis.
You said it, May.
That's right. A lot of hospitals respond to crisis in different methods. And one of the ways that I think that's most effective is team intervention, and looking at it through a crisis response team.
What's a crisis response team?
Well, the team of individuals that have skills in crisis intervention, such as psychiatrists, your BHA, Behavioral Health Associates, your nurses.
Do all hospitals have crisis teams?
Probably not all, but it would be a great idea if you don't have one to have one.
Yeah. So, how do you get the team there? Would you send up like a bat signal or something, or how do you notify the team?
Well, we can definitely use like code blue, code red, and we could use it. Some hospitals call it code purple. They could call it whatever they want, as long as they're all on the same page and identify the code team contact.
Well, and it sounds like a great plan and a great idea. I would worry a little bit that some people might see this as abdicating their responsibility on the units themselves and just relying on these teams to respond.
Right. Absolutely. We can't do that. We have to be on tiptoe on every single situation.
Yeah, so it's looking at a team, the entire hospital being a team, even though you have these individual teams. It's a good point. And I like teamwork, because I think that that we need to. We've been told since we were young, there's safety in numbers, right? And so it just makes sense in this environment to behave as a team, to act as a team, to support each other as a team.
And we tend not to get agitated when we know that we have someone watching our back and helping us out. That helps decrease the stress level as well.
Yeah, you keep each other accountable. There's a professionalism in working together as a team, so you know that you're supporting each other and reminding each other on what's expected of each other.
Absolutely. And it also helps the process of litigation when you have another person there on the scene to witness the situation and the intervention.
Yeah, that's a really good point. I mean, healthcare is a highly litigious environment, and you want to make sure you always have witnesses around to make sure that you can describe the events as they actually happened.
Correct. And you know, every team, you need to have a leader. And they don't necessarily have to have a title. It could be a situational leader and versus a designated leader.
And how do you decide who's who?
Well, you know, if in a situation an auxiliary staff is on duty and they find a situation, they have to do certain things. They have to check what's happening, address the issue, recognize, engage, but also escalate.
That sounds great, and I think that you know, I could see people struggling who haven't had TeamSTEPPS training on deciding those things in the moment, on who's going to be the leader, who's not going to be the leader. We talked about roles and responsibilities, and this is another area where it's so vital to have a TeamSTEPPS training in place so that ahead of time, when people are involved in an incident, they automatically just go into action mode.
That's right, and everybody know exactly what they're supposed to do.
Well, you know, I mentioned before, to me, the critical piece and why I love TeamSTEPPS so much is the idea of focusing on situational monitoring and situational awareness. I think that's the key to, especially in some of these more complicated places like a psychiatric unit, to rely on each other to make sure we're all paying attention. And I think that's one of the keys to TeamSTEPPS helping in these high-risk environments.
Absolutely, and you know what? You can't respond effectively if you don't know the situation, right?
That's true.
So it's really important to have situational awareness. This way you can minimize injuries and risks. And we know that humans are not perfect and processes are complex, so situation monitoring is a great tool to be in the toolbox.
Absolutely. And I like the support of each other and reminding each other of when you forget about a policy or a procedure.
Right. So in any situation, there's always a precipitating factors. And workplace.
Hang on a second, May.
What do you mean, hang on?
You're using big words again. What
well,
say that again?
Precipitating factors. Simply said, what is the trigger? You know, that caused that reaction.
Oh, I get it. Yeah.
So we have to understand that from the staff perspective as well as from the patient perspective, right?
Sure. You know, it's a big word, but I understand exactly what you're talking about.
So we have to prevent people from acting out. We have to be proactive. And again, going back to situation monitoring and awareness and communicating and escalating. But we also have to understand that, you know, when the patient acts out, it's not personal.
Right. And that's the key. You know, I have a law enforcement background, and that's something we train on early on, to recognize that this isn't a personal interaction, and that people in the situation, and it's the same approach in healthcare. You know, you're talking about people who have a loss of personal power. You know, there's not much dignity in being a patient in I don't care what hospital you're in. You know, you got tubes sticking out of you, or if you're in a psychiatric ward, you can't leave. You know, people are afraid. They feel less than. They feel like a failure. And those are all factors that can set anybody off or cause them to act out in any way. And then there's the other side where you have people who are either attention seeking, or they're just angry at something. They might have some issues where it's drug-seeking behavior, or they got some psychological issues. There are many factors that can participate. What's that word again?
Precipitating factors.
Someone having workplace violence tendencies. So, but it's important to recognize them.
Yeah, and you know what? Some of the factors that we don't even think about is sleep. Have you ever been in a hospital before? And every 2 hours, the nurses are coming in and out. I mean, it is very disturbing, and when you don't get enough sleep, you get agitated.
Yeah, I'm agitated right now. I was up all night worried about this presentation.
Well, don't worry about it.
All right.
So anyway, nonverbal signs of impending violence is also a way of identifying some of these signs before the patient gets to the crisis mode.
Yeah, you know, it's funny. We talk about situational awareness, and I mentioned before, like, you know, we're aware. You're at the supermarket. You see somebody who's, you know, got his eyes pacing back and forth. He's rapid breathing. His eyes are going back and forth, and you know right away, like that, I got to stay away from this guy. And it could be on the street, whatever. But for some reason, you walk into work and you forget about those things. And I think that, and that's why I love the TeamSTEPPS again, to remind everybody, to remind each other, hey, look at this guy, look at how he's behaving, or girl, how they're behaving, and that's an indication that something's about to escalate.
You're absolutely right, and that's the moment that you call for help, when it's at this situation, at this time. But, staff can also contribute to the issue as well. I mean, some of us get annoyed, we roll our eyes, well, come on, we all do that. So that's also some signs that can trigger a behavior.
Yeah, you're right, and I think, a little training on these things can go a long way. Some people, whether it's cultural or they're just not used to it, or don't understand the impact of invading someone's personal space, that the impact that can have, it's good to make people aware of it. And again, situational monitoring, not just for yourself, but for your teammates, your coworkers, to see that, to make sure they're not invading someone's space and escalating the situation. For those of you who have the diagram in front of you, you can see that there's a person standing there with circles around them expanding outward, and that first circle is an intimate area that, once violated, people can react in a very violent way. And so you want to kind of keep it in the social range, so that you can, it's not as invasive to the person who may respond. It's also a safety issue. Distance creates time, and time to react, and time to be safe.
You're absolutely right, but sometimes when we are talking to a patient, we might get a little bit too close, and the role of a team member is to really cross-monitor. If I'm getting too close, say, hey, May, may I speak to you for a minute, or maybe you want to just come over here. This way to remind each other and mutually support one another.
Great.
So it's not just what you say, but how you say it as well. Paraverbal communication, the component of tone, volume, and cadence, is really important as well, because the message may not come in the words, but the tone and the way you're saying it. For instance, if I'm annoyed, I'll just brush you off, right? Welcome.
I've seen it.
And have you ever seen a patient, a non-English speaking patient? What do the staff tend to do? They speak loudly, thinking that if I speak louder, they'll understand what I'm trying to say, and that's not true.
Yeah, exactly. And we do a lot of training when we and my officers who are in charge of the security here, on exactly that, on how they talk to each other. And I think the hospital world is identifying these as issues. The cadence in which you deliver your message, the rate and rhythm of your words can be very important to go along with tone and volume. You want to be as soothing as possible, and as calm and responsive as you can, but in an appropriate way. So we've talked about communication, cross monitoring, and situational awareness, and who would we be sharing all of this information with, and who would we be communicating with in our team?
Right, and these are some of the folks that I think that we should really, escalate information to, or hand off information to other clinicians, the doctors, the nurses, the BHH, social work, activity therapists, hospital police, the response team, the administration, as well as risk managers. We need to close the loop on the communication. If we don't, then we don't help each other out. Yeah. And someone might just get into the midst of things.
Yeah, I agree, and it's something we encourage with everyone who's involved. Not just communicating the state of things as they are, but also if a care plan is not working, to make sure the doctor understands that whatever's the care plan for this particular person, it may not be working, and so they can adjust it.
So one of the things, we talked about is nonverbal, but let's talk about the verbal interventions. And as humans, when we're in the middle of a workplace violence situation, we tend to overreact. We tend to try to get control of the situation, And sometimes we might end up making false promises, or sometimes we are using jargons, jump to conclusions, and these are all not to do. We shouldn't be doing that. We should be instead try to remain calm, isolate the situation, and when you have a behavioral health patient or even non-behavioral health patient, we have to enforce limits.
Yeah, I mean, that's, and again, in my law enforcement background, here's where there's a nexus. You never want to promise anybody something you can't deliver, and you don't want to set boundaries that they can then cross over, and it's a sort of a false boundary. It's going to escalate the situation. You talk about isolate. You don't want to give people an audience, so you want to make sure that you limit that, and that can cause more of a problem. But very, very important to make sure that you're firm but fair, honest in your communication, and with always the goal in mind. The goal in mind is what's best for the situation, what's best for the patient, and make sure that you're communicating the appropriate information to whoever you're dealing with.
And you're absolutely right. And sometimes we need to communicate to one another, and if we disagree with the plan of care, we need to use cuss and two-challenge rule and check back as well as closing the loop.
Great point. Great point, Mei. And that can make things even worse if you start arguing in front of the patient.
That's right.
You want this verbal intervention that we're talking about is to, you want to make sure that your information is simple and clear, all right, and it's reasonable and enforceable. So, I think we've kind of covered a lot of that in what we said, but that's really the key to making sure that things don't escalate.
You're absolutely right, and that also gives credibility to the care team. If we can't enforce somebody, then the other patients may see that, and chaos may occur. So mutual support is another component in TeamSTEPPS that is really, really important in reducing workplace violence, because it's not about me, it's about us, and we have to focus on what the patient is doing. Sometimes when we get really busy, we tend to be, siloed, and we're focusing on one task, and we're not looking at the big picture. So task assistance, cross-monitoring, and mutual support is critical for us to really keep our patients and our staff safe.
And I like what you said there, Mei. It's a reflection of the team itself, and when the patients see you working as a team, it's more effective overall.
You're absolutely right.
And that mutual support is also something that, without it, can create staff fear and anxiety. You feel alone, and that's why we encourage the mutual support, because that's going to make people feel more effective and safe. And to me, those become patient safety issues, not just staff safety issues, but also patient safety issues. If you're worried about workplace violence or worried about being safe, you're not going to be as effective and focused on what you're supposed to do. And basically, when people have fear and anxiety, there's two ways they can go. Their reaction can fit in the unproductive category, or it can fit in the productive category. You're either going to freeze, or you're going to have an increased acuity in your senses and be able to react faster and quicker and make better decisions.
You're absolutely right. And sometimes, when we're unproductive, we respond inappropriately, either verbally or physically, and it's just a reaction. So when you're in the productive mode, you step back and you think about it and you act the right way. So again, it's cross-monitoring and task assistance. If you see somebody who's freezing, hopefully you'll be there to help them.
So, and that's in the moment, but how do you control fear and anxiety in staff who have are in difficult situations?
Right, by being there. Knowing that you're there to watch their back.
Well, I can't be everywhere, man.
Well, or we can get other people and escalate it so the teams can come and help you. but you got to speak up. You can't do it all alone.
You're right. Excellent. Those are all excellent points. And you know, one of the things that we talked about early on about it being a personal attack when somebody's acting out, and I think that's one of the things that it's an easy trap to fall into, because we take our work personally. You take, especially if you have pride in what you do and you want to, you're working as hard as you can, and someone just doesn't like the way things are going, it can be very offensive. You have to have that rational detachment when you're involved in these situations. It's not about you. Violence in the workplace can occur, regardless of the precautions you put in place.
You're absolutely right. And, other things are, teaching staff techniques to protect themselves in acting when they see somebody acting out in a crisis. Like we said earlier, the distance with the patient, if you're too close to the patient, it's easier for them to come and grab you than if you stand one arm length away. This way you could step back and avoid the situation of getting grabbed. So I think really teaching people how to deal with the patient, like never turn their back while they're doing something with the patient. They always face them, so that they could see what's going on.
And again, that's where situational monitoring, cross monitoring, those things will help that.
Yep, absolutely.
All right, we've been talking forever here, May. Do you want to go to the phones and take the call?
Sure.
All right. I believe we have Bob.
Hey, May, Joe, Bob from Saskatchewan. I love your show. Big fan. Sorry, I'm a little nervous. First time caller, a long time listener. I really enjoy what you're doing. Anyway, I'm a BHA, Behavioral Health Associate, and I work in a psychiatric unit. I had a patient come in a patient the other day who came into the dining room and was acting agitated. So we called the crisis team, and when they responded, well, a bunch of the other patients started saying, hey, you come after him, you're coming after me, and it was a very tense situation, almost like a riot. I'm just curious as to how you might manage that situation. If you were in that spot. I'll hang up and listen to your answer. Thank you.
Well, Bob, that's scary, and unfortunately things like that do happen. But basically, you want to make sure that you're communicating. Most important thing is communicating. You have that team responding. You, as the BHA in that situation, you might want to say, call a timeout and do a brief huddle, and it doesn't have to take long, but just that crisis team responding needs to understand the situation as dynamic as you see it. They may not have that information. They may not be aware that these other people are going to react that way to support that patient and whatever that means. So I would say to you that the most important thing is making sure that you're communicating with the entire team that's responding, because don't forget, they may not have been on that unit all day or for a while. They don't know these patients. So you're there, you know it, make sure they have that information.
Yep, I totally agree with you. You got to, activate your crisis team so that they're there to support you. Don't try to be a hero and try to think that I can handle this all by myself, because you can't. You may be able to handle it now, but in 5 minutes, in 2 minutes, whatever time it is, it can get to a level where it is unbelievable, and everybody will get hurt.
Excellent. I hope that answers your question, Bob. You want to take another call, or you want to? No? Oh.
So there's basically, I say 10 ways to diffuse incidents.
Why is it always 10?
Well, the round number, and I like round numbers.
Never 8 or 5 or...
Well, you can add more, but don't delete any of these.
Okay.
So the first one is obviously respect all individuals, their personal space, their rights, what they like, dislike, respect them. And do a lot of situation monitoring. Very, very important. So we know what we don't like as human beings, neither do our patients. don't forget, they are in a situation where they have very, very little control, right?
Yeah, it can be very upsetting to lose that control, and sometimes it builds that sort of upset and anger builds up, and it comes out in a violent way. And you know, a lot of these people are dealing with a lot of difficult situations. So we have to understand that. We put ourselves in their shoes a little bit. Understand that, you know, it's not a personal attack on us, but just make sure that we're prepared to try and resolve the situation as peacefully as possible, and understand where they're coming from.
And one other thing that I would say with that one is that sometimes our staff look at behavioral health patients and they look normal, they're having a great conversation with us, but they're in a hospital, they're seeking help, and they're still our patients. So we got to just keep an eye on that.
Yeah, and also, I think it's important that I like number 10, so I'm not leaving that, because use physical techniques only as a last resort. You want to make sure that if you're going to have to put your hands on somebody, it's the last thing you want to do. We have to respect all individuals and make sure that you know, that we use that as a last resort, and that make sure that your nonverbals. I don't know if you just spoke about that, but that's one of the things that's important. Your own nonverbal cues.
And also being empathetic to others' feelings and mutually supporting. You know, this may not be the norm for that patient as well. They may just be, you know, agitated, upset, whatever it is. But one of the great skills, tools is the DESK script, which, you know, basically is describe, express, specify, and telling people the consequences during a conflict. A great de-escalation tool. And, of course, the most important thing is listening attentively.
What?
Listening.
Oh, I'm sorry. I was distracted. Do you want to take another call, May, or you want to move on?
I think we can move on.
Okay.
And so we're going to give our audiences a little bit of a homework and scenario number 2, and work this out, see what kind of strategies and tools you would be using, utilizing TeamSTEPPS for this particular situation.
Oops. Well, we spoke about it at the beginning. The goal really is to bring joy and meaning of work to your workplace. Workplace safety is inextricably linked to patient safety unless caregivers are given the protection, respect, and support they need. They are more likely to make errors, fail to follow safe practices, and not work well in teams. Like I said, when someone's afraid, it's a patient safety issue. They're not going to be able to focus on their job.
And you know, at the end of the day, we all know that better communication and teamwork can help our patients and staff feel safe.
Absolutely. The implementation of TeamSTEPPS will definitely reduce workplace violence and injuries through early recognition.
And you know, I always say KSA, knowledge, skills, and attitude are key attributes to enhance performance. And you can't have one and not the other. It has to be all three.
For those of you playing along at home, you can see the picture. This is what it's all about. We're all in it together. You can't look at one side of the boat that has a hole in it and think, oh, that's not our problem. We sink or swim together.
And so that's all for our presentation. We're here to answer your questions. And I hope you enjoyed the show from May and Joe.
Thanks, May and Joe. The show was great. I loved it. That was really wonderful. We do have some questions, a good amount that have come in, so we'll try to get through some of them right now. I think, and this kind of harkens back to what I said in the introduction about the advanced course, where you start linking TeamSTEPPS into other types of initiatives you might have in your hospital. Because a lot of people brought up other threat resolution, conflict resolution programs, and I'm personally not familiar with them. And people talked about CPI, crisis prevention and intervention. They also talked about management of aggressive behavior training, and there are a few others. And so I was wondering how it is that something like TeamSTEPPS works in tandem. How did you make the choices, I guess, of what tools to use and the pick and choose from TeamSTEPPS and then, I guess, the field of conflict resolution that exists?
Well, it's funny, when we were putting the presentation together, we specifically didn't want to name a particular de-escalation program because we didn't want to endorse one or the other.
Of course.
We've trained in, I have my people trained in, a couple of them trained in all of them, We've looked at all of them. We're trying to tweak each one to sort of come up with the best solution. So they're all very good, and I think they're a tool to use for sure. And as far as how they work with TeamSTEPPS, I think that TeamSTEPPS is an overall philosophy, and these other de-escalation programs are more like techniques in the moment to use. So they're not, they'll give you, like we talk about situational monitoring and having these communication skills in an organization to make it perform better and to get better results, whereas these programs are designed for specific responses to how to de-escalate a situation. So they're more technique driven.
And this is a great question because, CPI and other, PMCS, all are nonviolent crisis intervention, teaching you how to get out of a situation, but it doesn't really focus on the communication and the teamwork component that I think is so great in TeamSTEPPS, and really trying to prevent a situation from escalating instead of how to handle it.
Yeah, I see TeamSTEPPS as a more organizational approach on how to reduce these incidents, whereas these specific techniques are more designed to respond to the crisis.
Got it. Yeah, okay, so this is definitely something in tandem and not in competition. This is
absolutely
correct.
That's great. Great. What do you think about, a lot of the discussion was about, dealing with this approach for potential violence coming from patients or maybe from visitors. Do you also utilize this for staff-on-staff violence?
Well, yeah, we hope we don't have too much of that, but I think
Sure, but
I think there is an underlying sort of solution to that, in that TeamSTEPPS promotes communication, healthy communication on how to be professional in your interaction and an appropriate way to challenge authority when you are concerned, and so the tools are there to again, it's more of an organizational approach. The tools are there to minimize those incidents. If you have worker violence, they're definitely not working as a team, and they're probably underlying issues in your organization that may need to be addressed. So I think TeamSTEPPS is one of those things that it's not a tool to use to address a specific situation. It's more of an overall sort of philosophy in how to professionalize your organization and communicate in a way that avoids those issues.
And I think TeamSTEPPS also remove the emotional component of when people speak to one another, utilizing the same language and addressing the situation rather than the individual. So if we utilize that more often, there will be less staff-to-staff violence.
Got it. Yeah, that's a great, both of you guys I think have great points there, and I think that might really help the people that called in and signed in to listen that maybe aren't familiar with TeamSTEPPS as a whole program and are more caught by the workplace violence aspect of it, that TeamSTEPPS really is something that if it's culture change, and changing your culture will definitely cut down on those kinds of incidents like you're saying. So good, thanks. So those are kind of more of the big picture questions. We had some more nitty-gritty questions that people had too. So a couple people were interested about how you're using cuss specifically in violent situations. Is it to warn one staff member, maybe warning another staff member, for example, when you were talking about the personal space issue? Or is it used in some other way?
I think it can be used in any situation. For example, we had a behavioral health patient that did not like women. So a female BHA was assigned in the evening shift to this particular patient. And if I knew that, I could say to my boss who assigned me, I'm concerned, I'm uncomfortable, this is a safety issue. I understand from the handover that this patient does not like women, and he gets violent when he is close to a female.
Yeah, I think, and the other thing too is, again, it's best used as sort of to break through the hierarchical barriers that are in every situation, no matter where you work, but specifically in a hospital, you have the doctors at one level, and you have all the way down the line. So that's where it's the best utilized, where somebody who's on the team, but maybe intimidated by the doctor in charge or whatever it is, can break through by using that to communicate a worry about safety that they have, which is completely legitimate. And they do it, and that's what I mean about this affecting the culture and of employee-on-employee stuff, because it's really a communication tool to be able to communicate your concerns in an appropriate professional way.
So you guys have been doing this for a long time, TeamSTEPPS, and it's really something that is the way you do business. And so it probably seemed easy, Joe, to get your team involved, to get the campus police or security folks involved. How would you recommend going about doing this and bringing this in if an organization maybe wasn't so already in the weeds of TeamSTEPPS, maybe they were newer and they wanted to bring this particular program you're talking about to the fore?
Well, first off, I would say don't be so sure about how easy it is to embed TeamSTEPPS. This is like, there's no finish line. It's a constant, because you get new people in and the old people forget, and you have to constantly, you want to constantly continue to train and develop them. So there's probably people who work for me that haven't been exposed to TeamSTEPPS because they're new and we just haven't been able to train them. So, and sometimes it means you got to bring outside people in to facilitate that training, because like everybody else, we're all short-staffed, we have a million things going on. So to be able to offload that to somebody else is probably the easiest way, but it takes time, and it's not, you can't change the culture if 5 people know TeamSTEPPS. So you got to get it embedded in your entire organization. So it's a constant weeding the garden, but it's worth it, and I think that you shouldn't put it off because you think it's too monumental a task. Just start slowly and just make it as part of a culture change, and eventually you'll get there.
And I think the important piece is that it needs to be woven into the orientation. As soon as they walk into your store, that you have that language, shared with them, teach them, utilize it, role modeling, but also customizing. That's a real important piece, because if it doesn't relate to what I do, people are going to look at this tool as something, it's great, but it's not for me. So we really have to customize it to our audience.
Plus, another key point is to get leadership buy-in. To make, that's where it's going to start. You got to get buy-in from leadership that this is the way they want to go.
Yeah, that's huge. That's definitely huge. So somebody just, we're talking a lot about culture change, and I wanted to skip back to something else here. Somebody was talking about, asking recently here, how you got your staff, your provider staff, to promote that psychological safety that comes from the use of cuss. And I know that this is a bigger question. This is more on the full cultural implications of TeamSTEPPS in an institution, but what did you do to get that kind of buy-in from providers?
So when we did the training, we did it with a multidisciplinary team. We got everybody together, and we trained it, we simulated, and when we played it out, when we simulated, aha moment came about. They saw that, when we use cuss, it's not only clearer for the clinicians, but also the message comes out, quickly and appropriately.
Yeah, and I think the hardest part is getting them exposed to it and getting them there. From my experiences, once they see these things in action, they start to realize, oh, wow, this might actually work better for me, because I will get feedback other than my own personal observations about this patient and the care plan or whatever it is. So it's a force multiplier in a sense, where you're allowing people who might have a different observation of this patient because they spend more time with them and give you feedback in an appropriate way. That's not challenging. So it sets the language so that people feel free to challenge or at least give you information that you might not have had before.
And cuss does not point finger. It addresses the situation.
Right. Yeah, I thought one of you said a couple minutes ago just the idea that really TeamSTEPPS, these tools, take a lot of the emotion out of communication. And so that's huge when you're talking about reducing or de-escalating, I would think, any sort of situation. When you're training people in this, are you using any, or have you considered doing any sort of simulation work? How are they trained in dealing with
I think,
potentially violent folks?
We were doing a training a couple of years ago now, and we set up a kind of a 2-day program for 2 different units, and we realized after the first day that we were getting much more effectiveness out of our scenarios and role playing, and really, I think it's the key to when you're doing this training, because it puts the people back in their unit, in their minds, and they're seeing scenarios they've seen 100 times, and they know it, and they know when it comes out good, and they know when it comes out bad, and then they can use these tools, and it's an easy way to get them this, like Mei said, it's an aha moment for them where they say, oh yeah, because the scenarios we use are stuff they see every day, and the mistakes we put in there are things they see every day, and the successes are things they see every day. But just to expose them to that in the training setting is valuable, and you can see it really is effective.
And the interesting thing is that when they train together, they tend to bond together, and their relationship improved, and not only dealing with the situation, but the injury rate also decreased. So that really, validates that TeamSTEPPS is a great tool to have.
Well, that's great. That's the injury rate. That you have numbers on that too. That's fantastic. We are at the top of the hour, so before getting into another question, I'd like to instead thank both Mei and Joe for coming on today and answering all these questions and giving a great presentation and giving us something a little unique with the radio show, so it wasn't just folks talking. So really appreciated that as well. So thank you very much, and thank you all for listening in. I hope you all have great holiday season, and we'll see you again in January for the next TeamSTEPPS webinar. Thank you.
Thank you.
Thank you.
Ladies and gentlemen, that concludes today's presentation. You may disconnect your phone lines, log off your webinars, and thank you for joining us this morning.